Hello, everybody. Assalamu alaikum. My name is Muhammad Jaffer. Thank you for connecting with us today's Zoom in on the Halal Metropolis, where we are telling the story of Muslims in Southeast Michigan and how they are reacting to or coping with the COVID-19 pandemic. Today, I have Umaima Abbasi. She is a student of public health at the University of Michigan. Hi, Umaima. Go ahead and introduce yourself and tell us how you're doing.
Salam, everybody. My name is Umaima Abbasi. I am a senior graduating from the School of Public Health here at the University of Michigan. As Mojay had mentioned, I am a researcher that studies solutions for a lot of the challenges that vulnerable populations go through and experience here in the United States, specifically in Michigan and Detroit. And I'm also a GOTV organizer, so I mobilize communities to get out the vote. And I'm doing as well as I can be within a global pandemic. And thank you for having me.
Let us know your thoughts on what's going on from the public health perspective.
Yeah, so I, as a public health student and a researcher, this is an unprecedented moment that that a lot of states in the United States were definitely not prepared for, and we're seeing that right now. In terms of handling the situation, I think that governors in their respective states are doing the best that they can. I know here in Michigan, Governor Whitmer has definitely operationalized a lot of the ways that we can protect vulnerable populations here, specifically in Detroit, because we know that the Black community is experiencing this at a far higher level than the rest of us. But anyways, I think that at the start, the United States was super dismissive about COVID-19 and what it looked like, just because we didn't have as many cases as Italy or Spain or any of the other countries that got hit by COVID prior to us. I feel that because of that dismissiveness, which is very common in public health crises, we were unprepared, and we did not know how to create strategies that would protect people and prevent the spread of the virus. With that being said, I think that now, we're trying our best. I think that the most people can do when they see headlines every day is that really take them with a grain of salt. The media is, misconstruing a lot of the facts, and me being a public health student that, took Statistics 250 and understands how stats works. A lot of this information is just made to scare people. So of course the United States is going to have higher cases every day because, testing is not as accessible here as it is in other countries. So the more people are getting tested, the more positives we're getting, the more cases we're seeing. So, I think that we have a very long way to go with COVID-19, but I think that remaining positive and staying connected is something that we can do as a community.
Yeah, definitely. I think that, access to good information is very valuable in a situation like this one. And you actually do a really good job of breaking down different aspects of what's going on right now on your social media accounts. Why do you think that, having access to information, good information, and being aware is so important?
Yeah, no, absolutely. So I think that the accessibility of information is critical, especially when we're dealing with a public health crisis and a global pandemic, is because all of these issues perpetuate further health disparities. So accessible information that's jargon free and easy to comprehend and understand is important when communicating with individuals and communities on how they can protect themselves and how this virus is spreading, and just day-to-day things like, what does social distancing even mean? Did we know what that meant when that was going out? What social distancing looks like for me is probably not what social distancing looks like for folks in Dearborn, for folks in Detroit, for, you know, the lay public that probably doesn't pick up a science article every single day as their choice of read. So stuff like that is important if we want to prevent this disease from spreading and impacting people more. The reason that I ramble on my social media on why this is important is because I know for a fact that if I can spread it to at least 20 people, then they can have that domino effect and have that conversation with their families and their communities. But yeah, information is important because, you know, we saw Governor Whitmer issue 5 different executive orders on, you know, shutting down the city and having essential services open but non-essential services closed. That's basically social distancing. So if we could have just said that from the start, then maybe, just maybe, Michigan's numbers would not be as high as they are today.
Yeah, and by the way, I appreciate your rambling on social media. It does help keep me and a lot of people informed. You know, people like you have been concerned about issues like public health issues for a while now, whether it be, you know, access to healthcare or you know, disparity issues or whatever. Do you think that awareness is growing and it's gonna um, sustain even after the pandemic is over? What are your thoughts on that?
Yeah, so I mean, I am filled with like so much gratitude that folks actually now understand what public health is and why it's important. Um I mean, in terms of like maintaining what's happening right now, especially when it comes to like social media and reading the news, I would say that still, like to this day, people are only accessing information that they want to access, information that, you know, is easy for them to swallow. um I have yet to, you know, interact with people that are breaking that boundary for themselves and, you know, trying to like understand, you know, the basis of this information. So like, for example, I saw this thing on Twitter the other day, and it was something along the lines of like, you know, we knew that COVID-19 was going to disproportionately like impact the Black community in Detroit. We knew that was going to happen, you know, like Detroit has been abandoned and the community there has been abandoned for a very, very long time. Now, it's different when we read news articles and information that says, you know, this is a product of race. Now, I need people to understand that it's not just about race. It's basically racism. So the way that this disease, when people are saying it discriminates, it does not discriminate. More so, it's racism that's at the cause of this. So the reason we're seeing these high cases is because of the systems and institutions that are in place that are perpetuating racism. So, I mean, I really would like to think that after this pandemic, we maintain the resiliency around accessing credible information, around having conversations surrounding neglected tropical diseases in the global region. But like the optimistic person in me wants to believe that, but unfortunately we know how societies operate, we know how individuals operate. Once this is over, I am afraid it's going to go back to the day to day. For certain people, that's not going to be like that for everybody, but for certain people it's going to go back to the day to day, because unfortunately people didn't use this quarantine to kind of open their mind to everything. Basically, it was only information they wanted to digest. So that's my take on it.
Umaima, thank you so much for providing so much good insight on the issue that's happening. Thank you so much for all the work that you do, and also congratulations. You're graduating, right? So you're finishing up your studies. Yeah. So thank you so much. Thank you to anybody who's listening. If anybody has a story that, you know, they want to share, please let us know. And everybody stay safe and healthy. Thank you again. Assalamu alaikum.
Yeah, well,